Good. Oh, shoot. Okay. So Cestex or Droncit are two common treatments. And fenbendazole, depending on, or Drontal Plus. So Droncit, Drontal, Cestex are going to be the more common medications. There's some notes underneath here about some dosages, which I'm not going to quiz you on necessarily the dosages, but Drontal and Droncit are probably the most common that we would see. As far as now moving on to Protozoa, which the two main things we're going to see are Coccidia and Giardia. And so now Cystospora canis, Cystospora felis, Toxoplasma, so toxoplasmosis goes in this, Cryptosporidium. But these are typically single-celled, unicellular. There's a motility to them, but let's talk about the Coccidia or the Cystospora category. Carnivores and herbivores are the host. They live in the intestinal tract. There are non-sporulated oocysts. So these can start to spore. There's a picture that we'll look at that shows kind of the spore formation. But these are non-sporulated oocysts. In the environment, when they sporulate, that's when they can become infective. And from ingestion or the pre-patent period, anywhere from a week to 2 weeks, by the time, maybe they start to show signs. What the big, and this is the life cycle is direct, so it's passed in the feces and they ingest the oocysts or the sporulated oocysts, and then they become infective. So it's found in the feces in dogs and cats. Watery diarrhea, very loose stool, is kind of the very common complaint or presenting sign. Now, again, if you've got a puppy and you've got watery diarrhea, we talk about parvo tends to be like, oh, we're up here on our list. Although I will say, if you've never smelled parvo, it has a very distinct, it's the one thing I can't handle. This maybe wouldn't have that same smell, but then would have maybe a very watery stool. But we do worry about dehydration is going to be the consequence. Now, if we have very watery diarrhea in a kitten, I'm not talking about parvo, we're probably talking about coccidiosis or this coccidia infection. But again, the smaller they are, the younger they are, the smaller they are, then we're going to worry about potential dehydration that can occur. There are some other signs here underneath, but it's a very, very common parasite that we see in puppies and kittens very early on. And if you look at this, it almost looks, like a little floating cell. So you've got fecal material. This is all just fecal material. And then you've got this very small, thin shell, small cell. That's felis, and this is canis, so very similar appearance. Now, you can find this on just doing your standard fecal float that we have at school, but they're very small. So again, if you're looking at this, and let me go back. This one is forming a spore. So you can see that it's got that double appearance here. So this is the spore formation. So then that one's shed and that one's infective and that one can be ingested. So I didn't meant to point that out. So treatment here, it can be a mild case where we don't have too many clinical signs, but the treatment can only shorten the duration of infection, which is obviously the more clinical signs. Sulfadimethoxine is the approved treatment. And if we talk about that, if you've ever heard of Albon liquid, is what we would most commonly use. And, you know, treat that. And most of the time we're going to treat it. There's trimethoprim sulfa, sulfamethoxine. But again, even when you're treating, sanitizing, cleaning up the areas where there's been stool, ammonia-based disinfectants can kill this. So it's not like it's one of those hardy ones. It can be cleaned. Pressure washing and steam can also work as well, but good sanitation. Now, Toxoplasma, which is carried, the host is the feline. If it's found in other species or people, which it's incidental, it's not, we're not the primary host. But again, if we're dealing with a lot of cats, then we could potentially get infected. And they have unsporulated oocysts, so we don't see the spore formation. But in 1 to 5 days, they can be infected. Let me move down here. If we're talking about picking up Toxoplasma in a person, the big thing we worry about, and if you've heard about pregnant women and not dealing with litter boxes, it's because we worry about toxoplasmosis, which in people you can do, and you can do this in cats too. But if we wanted to pick it up, we can get a Toxoplasma antibody test to see if we've had antibody formation, which would indicate that you were exposed. So if you guys remember, and this kind of leads into virology, if antibodies are formed, it doesn't always necessarily mean there is active infection. It could be that you were exposed, you formed antibodies. So, you know, it's not, if you're talking about titers, whenever we're measuring antibodies, we're talking about titers, and that will measure what level of titers, which can sometimes kind of help monitor that infection better. But a positive antibody response, it indicates exposure, but, you know, it can be an ongoing infection that you have to get that titer. There is a note here that cats can have tissue cysts for life, so that it can form in the cyst and they will continue potentially to carry it. Now, this one, it does look a lot, and this picture is not zooming in for me. So the oocysts can actually begin to pass within 3 days of them ingesting, you know, the host, mouse, whatever. So, you know, now here's one that's sporulating. So you can see the spore is forming, and here's an unsporulated form. Okay, so you've got sporulated versus unsporulated to compare to. I will let you read some of the notes underneath. One thing that there's a note under here is that if someone is, maybe they're pregnant, maybe they have, you know, sometimes we'll say, you're pregnant, don't deal with the litter boxes, someone else will deal with litter boxes, but you want to wear gloves and change the litter often so that the feces doesn't have time to sit there and form spores. So daily cleaning, wearing gloves, obviously washing your hands after doing that is going to reduce the risk of infection. You know, the other thing, you know, I'll put a note about this just because to be cautious. If you're working in the garden and digging in soil, wearing gloves is important because, you know, a lot of cats, stray cats that used to live by my grandparents' house, they had really soft soil around the house. And whenever my grandpa would go out in the spring, he'd get so mad because he'd be digging up all this cat poop. And they had lots of stray cats in their neighborhood. So, you know, anytime you're digging in the soil, you have to be careful as well. So, you know, if you're dealing with litter boxes or you're digging in soil, using that caution because of those sporulated oocysts that you have to be careful for. And here's just kind of a size comparison. So Cystospora, or we're looking at our coccidia that's sporulated here, and look how much smaller these are. So gives you an idea of the size difference there. I'm trying to think in fecals if I've ever seen this. It's not like as common as your coccidia would be, but can be seen. And then there is Giardia. This one's always hard for me to pick up on a fecal. I'm just going to be honest. I always have somebody come help me. You know, they have this distinct kind of shape and tail, almost looks like little whisker hairs and eyes. They're a very interesting shape, but animals and people are the hosts. So these are definitely zoonotic. They do live in the small intestine versus the large intestine. But once they're ingested, they attach to the small intestine, the lining of the intestine, which causes inflammation and a good amount of mucus production. So that's, you know, sometimes, and welcome to being a vet tech, you know, anytime, and nowadays with phones, if clients say my dog has diarrhea, and, you know, I'm like, what's the consistency? What's the color? What's this? Can you take a picture? And I know that may sound weird, but this one may have a little more mucus component to the diarrhea versus just a watery diarrhea. One thing, if this infection is allowed to continue, then we can talk about malabsorption or maldigestive enteritis. So enteritis is just inflammation of the small intestine. But if you remember from anatomy and get into, you know, when you got the cilia in the intestine, if they're inflamed and they swell together, it decreases the surface area. And when things go too fast through the small intestine, then the small intestine doesn't have enough time to absorb nutrients. That's what we talk about maldigestive or malabsorption disorders. So anytime things are going through too fast, you decrease absorption time, you decrease surface area. So are they getting skinny? Or an animal that's malabsorptive, they tend to be more hungry. So if we've got mucousy diarrhea, tends to be losing weight, eating but doesn't seem to be gaining weight, that's kind of all pointing potentially into one direction. But we have to be careful with the stool, definitely zoonotic. Clinical disease, pale, pasty, foul-smelling stools. I'm doing the GI lecture, so maybe that's why it's on my brain in anatomy. And I was talking about exocrine pancreatic insufficiency, and I was talking about foul-smelling stool, and they're probably thinking, well, isn't all stool foul-smelling? There's normal poop smell, and then there's going to be, you know, like parvo has a smell, and you've got normal diarrhea, and then you might have this type of diarrhea and it has more mucus. So there are different types of consistencies and smells and to diarrhea that sometimes can point us in a direction. Because again, when an animal has, I know I'm off base for 1 second, if an animal has exocrine pancreatic insufficiency and they're not properly digesting the fat, protein in their meal, the stool comes out and they have what's called steatorrhea. It's like a fatty stool. It's technically rancid fat. It's coming out and it's not digesting, and that is very foul. It's very different from a normal diarrhea. So sorry, it's just something to think about when you have these animals with these cases. You'll notice these differences. So diarrhea as soon as 5 days. So within 5 days of exposure, you can get clinical signs. It can get underdiagnosed because of the intermittent shedding. So they can have some diarrhea and, oh, it clears up. Well, then you're like, did they get into something? Did they get into the trash? They don't feel good for a few days. So the trophozoites in the feces, they're going to be rounded and then have the pointed end. We'll look at the picture. And the cysts will be ovoid and have no flagella. So the cyst versus the trophozoite. One thing I want to mention here is, you know, you usually start out by doing a fecal float. The centrifugation method is going to be more accurate, but like usually your standard float, you don't centrifuge it. You just put it in the fecasol, put it in the little normal fecal holder with the fecalizer, but you may have to save some of the stool if we suspect this, to do the centrifugation, or you can do a direct smear where you actually just take a Q-tip, smear the fecal material, you know, kind of like when you guys do an ear swab and you kind of roll the Q-tip back and forth. I'll take the fecal material and I'll roll it. I flame it for the bacteria, and then you can look at it directly. There is, and I think JC had mentioned something about that, there's also an ELISA test. So you might send this out to the lab and do the ELISA test. I think she mentioned they sent it out to Antec. So if you do a standard fecal and then the doctor says, let's just send it out to Antec to do the ELISA, because I will say I'm sometimes questionable if I'm good at finding Giardia. So you do have this other testing that you can do. And it may be having to repeat the fecal because you may have gotten the sample while they're not shedding. So maybe the dog had symptoms. You told the client, well, come, we make an appointment for this day, and then they're not shedding that day. So you may have to repeat a fecal. Let me just mention the drugs here, that there's not a specific drug approved, but we often use metronidazole, which is Flagyl, is the primary treatment. Maybe fenbendazole or Drontal Plus, but most often we're going to use metronidazole for a course. And then cleaning very well in the environment. You know, cleaning contaminated food and water, remove feces, clean up their feet. You know, I also worry sometimes when my dogs get into like random puddles, or they've gone into like a pond and then they're licking pond water, and you can think of lots of things, but that's another time I think about Giardia. So here, now this is Giardia bovis, but you can see the cyst stage. So you've got kind of a cyst wall here. You can see that wall. Looks like they have little eyes, which are the nuclei. But then you might see it in this form where they actually have now formed the flagella, and they have the axostyle, which is kind of like the point. Think about like an egg growing into a tadpole, and then the tadpole starts to form like the tail and the little legs, because here is what you may see more commonly. You start to see, and it's a little bit harder, but you can definitely see the flagella. And then in this picture, you kind of see that, yeah, maybe that's a flagella. It's starting, you know, it's going from this cyst form. You can almost make out it's starting to where the flagella is going to grow, and you can definitely see the flagella in this picture. And you've got the Giardia troph right there. So, and the Giardia cyst right here. And again, it takes, you know, sometimes it takes more practice looking at different samples, and out, you know, like I said, a lot of, whenever you're unsure, most clinics are going to have a parasite book. You have your parasites, they may have a poster. There are a couple links here that may help. This Bayer DVM drug company has some good information. And then on your main Moodle page, actually, let me go to that real quick.
I have a question real quick.
Oh, sure.
Do you think it becomes easier to remember which drugs treat which once you're like in practice and actually doing it?
Yes.
Because I find it is a lot easier for me to know things when I'm like connecting it physically. But
yeah, because
you
know, it's funny. There's so many different parasites, and even like I said, when I was talking to Gillis, and I was like, you know, I've been very honest. This is not my strong suit. You know, I remember a lot of this from practice, and I feel like you were saying, Anna, I'm like, every time we found coccidia, my boss called for Alba, and every time it was rounds, we got Strongid. Whips, we got Panicure. Fleas or tapeworms, we got Droncit. You know, Giardia, metronidazole. And I felt like, so every time we had a case, I'm filling the same types of medications, and I think the important thing to understand is, first of all, and I know this is just a little tip, don't be afraid to ask for help. Say, hey, look at this for me, because sometimes I think people might think, oh, is it a weakness? I mean, like I said, he had some interesting diarrhea, and when I did a fecal, Dr. Paul looked at it for me, and then we think he had Clostridium. So he had like an overgrowth of, and I can't remember if he got into something that I was concerned about. I'm thinking back, but I was like, hey, Dr. Paul. And then so I made a smear. I started with a standard fecal, didn't see anything. Did a smear just to see if it was bacterial overgrowth. Obviously, I'm going to find bacteria on a fecal, but he picked up what he thought was the, Clostridium, and then, but sometimes I've had to ask for help, like, hey guys, look at this with me. So identifying the common parasites is the most common. What are the common parasitic medications? And understanding, like the different hosts and life cycles, mostly so you can talk about with owners how to decrease, exposure. I worried about, some people may not be worried about Balis ascaris, but I back up to the woods and I've seen raccoons. So like when I lived here and my kids were little, and if they'd be in the woods or I was like, I'm in an environment where, I could potentially, my animals or my kids could encounter Balis ascaris, where some people, they're in an apartment building in New York.
Mm-hmm.
I don't know. So I think that's what you understand, is just that will definitely come easier for sure.
Okay, good.
Yeah. Yeah. Cause like I said, I could list, even though I haven't done it in a long time, I still remember like Albon for this, Panicure for this, heartworms a little different, and, some of the flea stuff, but those very common, medications we use seem to have not changed for the most part. So yes. Do you have any other questions? Hopefully that I can answer. What I'll do, I'll end this and you can leave. Well, what I can do is you can leave the call. I'm maybe going to go back and talk about the first slides real quick because I forgot to hit record. So while this is still live, I'm going to just go back and mention a few things. Okay.
I do have, oh, sorry. I was wondering if it's okay if I have a little bit of an unrelated question. I was waiting until class was done to ask.
Oh, sure.
It's not super big, but do you think, have you?
Okay, so sorry, I'm going to go back. I forgot to hit record at the beginning, so let me just hit a few. We picked up today's lecture with whipworms, with the Trichuris species, vulpus in dogs and foxes, ovis, sheep and goats, suis, I believe suis, pig, do reside in the cecum and colon. So symptoms are going to be lower intestinal versus upper intestinal. They do shed eggs intermittently. They do have the barrel-shaped, football-shaped bipolar plugs on each side, very thick wall here. And if you look at the next picture, same football shape here with the bipolar plugs. And then this looks like a roundworm species, probably Toxoplasma. You could see it's more round. It was hard to tell in this picture if those are plugs, but it's much more round, so that wouldn't fit. And then kind of the nickname, and I said if you had Sipes for parasitology, I think she called Tricky Vicky, something Tricky Vicky's whips, Trichuris vulpus, and maybe that helps you remember. Also in the slides, I always remind you, you can look underneath here in the gray box that gives a lot of extra notes. So I'm not reading you the entire thing. That talks a little bit about the pre-patent periods. Now, fenbendazole or our Panicure is our most common whipworm treatment. We usually send them home in 3 packs because you can do a pack in the food, repeat it in 3 weeks, repeat it in 3 weeks because it's shed intermittently. And I keep reminding, little tips is that telling clients why are there 3 packets? 1 packet isn't going to necessarily, and you have to impress that upon owners because if they give 1 packet and then their dog isn't having diarrhea, they still have to do the other 2 packets because of the emergence, the different parts of the life cycle. So I always stress that to owners. Some of these other treatments will work. The only thing Strongid does not work for whips. So, low zoonotic risk, but the eggs are very resistant in the soil. So again, sanitation is going to be key. Preventing, high pressure steam. Not a lot of people are probably flame throwing their floors, but that's, sanitation is going to be key. We started to talk about the tapeworms, the cestodes. There's the taniid type and the non-taniid type, which Tania pisciformis, Tania taniiformis, Echinococcus granulosus, and multiocularis. But the Diploidium caninum, which is in the canine and feline, which is the non-taniid, is the more common form. The length, we talked about the length, which is the length of the proglottids. So it's not like one worm. These are the little segments and they can latch on. Most often, I started to talk about this, you tend to see this individual segments. It's rare, but sometimes you will see like a whole strip come out, and it can vary in length. But what you often find, a lot of times this gets diagnosed not even by doing a fecal. You just lift up their tail, maybe to take their temperature or do their physical exam, and then you see the little dried proglottids, which are the little, like they look like flat dried pieces of rice. And that's what we find when we, do an exam, and we may treat them just based on that without doing a fecal. So that's just kind of a common thing that can happen. You've got the scolex is the attachment that has the suckers. The strobila is the body part. And so you can have, but the proglottid is the segment. So the proglottid is the segment. And then you talk about the scolex versus the strobila. But the proglottids are what you find that are, and sometimes you see they pass the stool and they've got these little flat pieces that are like attached to the stool. So sometimes they're on the stool. Sometimes you see them in the fur around the rectum. And you can see, and the eggs are inside the proglottid. So sometimes you may just find the proglottids and not see the actual eggs. Let's look at, I did put a note here that the tapeworms can be asymptomatic. They don't tend to cause like some massive diarrhea like some of the other parasites. We do worry about, there can be some GI upset, heavy infection, potential weight loss, can get some perianal irritation because those proglottids may migrate to the outside of the rectum. So scooting or chewing near the back end might be something that's seen. It has this very thick outer shell. There's lots of notes under here as far as, I didn't read the whole thing, but you can see this very thick shell. Almost looks like it has like spindles within the shell. These are the Tania species. So you can see very, very thick. And then we have the Diploidium caninum, which is sometimes called the flea tapeworm. And this could get potentially confused with a hookworm because you have this very thin shell. You've got a cluster of these eggs in the middle, or, they look like the little nuclei here. But this one kind of stretches to the edge of the cell. So, or of the, of the shell, sorry. Versus, the hookworms, they were kind of condensed in the middle, had some space, and then the shell. So they're a little bit different. And also the other thing I didn't mention, I'm glad I'm re-recording this, is the hookworms tend to have more of an oval shape, and this is going to be a little bit more round. So it's the most common tapeworm in dogs and cats. It does tend to reside in the small intestine, but they can begin shedding 2 to 3 weeks following infection. And a lot of times I made a comment that sometimes an animal, like a puppy, middle, 1-2-year-old dog comes in with fleas. Sometimes we'll go ahead and give them the medication or give it to the owner and say, start this in a week or two, because it can be common to see this with flea infestation. So sometimes we will treat these animals even without seeing the evidence, evidence of a proglottid or a fecal sample, just because it can follow a flea infestation. So sometimes the doctor may go ahead and treat. And here's a chain of those proglottids. Like I said, sometimes I've seen some stool samples when we can see this come out with the stool, and sometimes you're just going to see the little individual pieces. So the most common treatment, and again, like I said in the earlier lecture, I can kind of remember, like, if we see this, we give this. I feel like Droncit is our most common medication. Cestex, now think Cestode, Cestex, which praziquantel is Droncit, Esperantil is Cestex, but those are very common. Drontal Plus is the praziquantel, Pyrantel, and Fabantil. So a Drontal Plus can be a good medication, especially if they have, other parasites in addition to tapeworms. Just like I talked about HeartGuard Plus the other day, it's treating, it's preventing heartworm and treating roundworms and hookworms. So it's kind of like just a lot of the newer anti-parasitic medications are kind of treating, obviously in practice we have the ones that, give this for this, this for this, but a lot of these medications are covering more than one parasite, because it is very common for them to have more than one parasite. And then the Coccidia species, I think this is where I possibly started recording. So if you have any questions after watching this video, sorry that it jumped around so bad, let me know.